Hi, I'm Dr. Langley. I work at Pine Ridge Family Medicine, a direct primary care practice in Colorado Springs, Colorado. And I have a question for any of you who have ever used something like this to clean out your ears. Have you ever looked on the box of a box of Q-tips and seen the warning on there? It specifically says to not put these inside your ear. Never. You're not supposed to. These are not ear cleaning materials. That said, how are you supposed to clean out your ears? Let's talk about that today. So, your earwax is actually a really good antibacterial, good stuff. It's supposed to trap bacteria and bugs and dust and whatever else is getting in your ears, and it slowly migrates out of your head. It gets pushed along out of your ears, and then you go like that or with a washcloth or something like that and clean it out. And that's how your ears are supposed to work. The medical term for earwax is cerumen, right there. So it's called a cerumen impaction if you get so much earwax in your ear that you start to get symptoms from it. So that could be things like hearing loss. It's just not as clear as it used to be, feeling a fullness in your ears, even pain in your ears, itchiness. Some people will even get kind of an irrepressible urge to cough when they have fullness in their ears. Even sometimes when I look in people's ears with that fancy otoscope, the little flashlight for looking in ears, people have an irresistible urge to cough. It's a reflex that they have. Fun fact. Some people feel dizzy or a ringing in their ears if they're having a lot of earwax in their ears. So obviously it can be a problem because feeling dizzy or in pain is not a good thing. And there's a variety of reasons why some people get more impactions than others. Sometimes people even have skin diseases on the inside of their ears, like eczema, that can make them more likely to have impactions in their ears. If they have some other systemic illness that affects their ears or even their bones in their ears, like Paget's disease, that can be something that traps the earwax or makes it less able to move along, or in other words, just gets in the way. You don't have to figure out why, but if you happen to have really sticky earwax that doesn't do what it's supposed to, you got to find a way to get rid of it, right? So a lot of people resort to this, but don't let that be you. This is why I'm making this video, is so that you aren't one of those people using Q-tips in your ears. The problem with using Q-tips in your ears is it's not really good for hooking earwax and bringing it out. I mean, you can imagine having a bunch of earwax in this poor dry erase board guy's ear, and instead of bringing it out, it kind of pushes it in, and it pushes it against what this is. This is supposed to be the tympanic membrane on the inside of your ear. It's a really sensitive place, and it's also where your hearing is coming from. The sound waves bounce through the air down your ear canal and against this tympanic membrane. And so if that's covered in earwax because you've been jamming it down in there, that's a problem. That'll get in the way of your hearing. And maybe if you're pushing it hard enough, you can even poke a hole right through that tympanic membrane. That hurts a lot, and it takes a while to heal, and every once in a while it doesn't heal at all, and it needs help from an ear, nose, and throat or ENT doctor. So those are some reasons not to do it. Another reason is actually this whole canal is pretty much straight bone. It's skull bone, and it has a really thin, like one itty-bitty layer of cells between this canal space and this bone here. So it's really easy to tear that tissue, and then it gets calloused, or it gets itchy and uncomfortable from being constantly irritated. So we're trying to avoid that. We're trying to remove the earwax while also not hurting the inside of that canal. Because if you get that irritated and it gets all swollen up, there's not that much space there before it starts blocking things off and causing infections and other issues. So this is the little snaily guy that allows you to hear and communicates with your brain. This is not exactly accurate anatomically. There's some cool little bones in there that connect the canal to the snaily guy. And then you have these cool eustachian tubes that tell you where you are. Not eustachian tubes. Oh no, I can't think of them. Semicircular canals that tell you where you are in space that contribute to your dizziness that's related to the ears. You also have a cool eustachian tube that connects the inner ear area here to the back of your nose and throat. All sorts of cool things that are not depicted today. We're just talking about cerumen. So there are some variety of things you can do for cleaning out your ears. One of them is to go to a doctor and have them clean them out. And sometimes if they've got a really nice view with their otoscope, their flashlight into your ear, they can use one of these. You can see it's a little curette. It has a little loop that you can kind of scoop the earwax with and drag it out. That's why it's better than a Q-tip, because it has that space to collect it, as well as you're looking at it while you're taking it out of someone's ear. So that's a good thing. You know that you're not going to go and puncture an eardrum, and you're being careful not to touch the sides of the ear canal. It's kind of like that game Operation where you're trying not to touch the sides. That's one thing you can do. Another thing that a doctor can do in their office is use an ear wash kit. We really like this ear wash kit. What you do is you put a fancy little nozzle on the end so that I don't get sprayed with your gross old earwax. So I have a little shield there, and then a little spray tube that I change out for every patient, and the tube goes into your ear, and the spray shield keeps me from getting splashback from your ear juice, and then I spray the inside of your ear. But as I said, the ear canal is a really delicate place, and getting hot or cold or any kind of water sprayed in there can be pretty uncomfortable. So not all my patients like this very much. I also have this cool little thing that goes underneath their ear to collect the water and the fun little chunkies that we get in there. So we can take a look at that afterwards and go, ooh, ah. So that might be something that you could ask your doctor about, is an ear wash. But sometimes it's really uncomfortable. And honestly, the best way, rather than have your doctor stick all things in your ears, is to get into a routine yourself of making that wax so that it comes out more easily. So one of the products that you'll see over the counter a lot is called Debrox, is the brand name. It's what it is it's carbamide peroxide. That's a really common one. What it does is gets in there, it not only softens the wax so that it slides out more easily, but it has that peroxide element, which is a little bit bubbly and helps to kind of elevate the wax as much as it can so it floats out when you get rid of it. You just follow the directions on the package. That's a good option. Hydrogen peroxide is actually a really good one, especially if you're kind of hooked on these Q-tips, because after you've been using these for a while, not that I've ever done that, you get this like itchy sensation and you need to use them. You get hooked on them. You really need to satisfy that itchy sensation in your ear by scrubbing in there with your Q-tip. So in order to break that without just suffering all day, feeling like you have itchy ears, I really like hydrogen peroxide, because it has those bubbles in it that satisfy that itchy feeling, and it makes it feel better without having to resort to the Q-tip. So to do that, you take your bottle of hydrogen peroxide, you tilt your ear, you pour some in your ear, you get some all over everywhere. You sit like this for about 30 seconds or a commercial, and then you get a tissue and tip out the hydrogen peroxide in that ear, pour it into this one, sit for 30 seconds, and do that every couple of days when it's bothering you. Either of those is going to irritate the inside of that delicate inner ear skin, though, if you do it every day. So really, maybe 4 or 5 days at most is what you should be using those for. Give yourself a break. Then if you feel if you need more clean out in the future, you can use some more. But you don't want to dry out the skin, especially if there's a possibility that you might have eczema or some other irritating skin process inside your ear there. I mean, you can always ask your doctor and say, hey, does it look like I have any flakiness or redness going on in there? They can give you an idea of other things you can do for that. You might even need a steroid drop. Just like you use steroids for eczema on your skin, you could use steroids for the eczema inside your ear if you need to every once in a while to help soothe that skin. And then finally, another thing you can do to make your earwax less sticky is to add more oil to it, make it more slippery instead of more sticky. So mineral oil is another good option. You put maybe 5 to 10 drops in your ear, or what's even better is you take a cotton ball. You put some mineral oil on the cotton ball and you stick it in your ear canal for about 10 to 20 minutes once a week. You can do them at the same time. And if you wear earplugs, that's something that can block your, if you wear hearing aids, that's something that can block the normal progression of earwax out of your ears. So make sure that you give your ears maybe one night a week where you don't wear your hearing aids at night, so that you give your ears a chance for that earwax to come out. That would be a great night to also stick the mineral oil cotton ball in your ears to help it to mix in with the wax and make it less sticky. Yeah, that's another point. Anything that you stick in your ear canals are going to block the progression of your earwax out. So if you're using earbuds a lot, you're hearing earplugs to block noise, that'll also block the earwax. Hearing aids, those are all reasons that you might have particularly bad earwax. So giving your ear canals a break once in a while is a good idea, as well as that earwax treatment can be pretty cool too. So those are some ideas for how to keep your ears happy. And by all means, if you're having any question about, especially if maybe you've had a sharp pain and you wonder if your tympanic membrane has been ruptured, whether it's by accident with a Q-tip or it just maybe got infected, or if you have any question at all, I want you to make sure you see your doctor, because getting mineral oil or deep rocks or hydrogen peroxide inside your inner ear, if this tympanic membrane gets ruptured, is a bad idea. So if there's any doubt in your mind, make sure that you get checked out by a doctor and make sure that there's no holes in your tympanic membrane before you go around sticking cotton balls with mineral oil in your ears. But hopefully that's helpful. If you'd like to watch another video that might be helpful, check that one out, and be sure to subscribe to our channel so you can see when we put new ones out. Thanks for watching.